It changes a lot when someone who's 200, 300, 400 miles away is making decisions. In doing so, I saw a lot of things in big corporate hospital America that didn't like. Difficult access to the administrators, if any access at all to the administrators. As a surgeon, not access to the equipment that I feel comfortable using. I was told what we're going to use, that's what the contract was with, that was it. Didn't matter what I trained with, didn't matter what I felt comfortable using, I used what they told me to use. National standards state that on a medical floor in the hospital, your nurse to patient ratio has to be 1 to 9. That's the national standards. You better believe corporate America has 1 to 9 nurse to patient ratio, because what's the biggest expense a hospital has? Payroll. Corporate hospitals, what they want to do? Make money. So what do? They have a 1 to 9 nurse ratio. The patient care drops. The patients quite often are not happy. Versus here, for the most part, I'd say it's 1 to 3, 1 to 4 nurse to patient ratio. So it's a much smaller ratio, better patient care, more on top of things. If you go to the hospital here versus somewhere else, you'll see the difference. I don't know why or how they can not listen to the people on the ground, the people who do this every day for a living, the people who are out here churning it out, why they can't listen. If you look and do a little research around the country as these smaller hospitals have been bought by bigger hospitals, a lot of times the plan is to engulf that hospital. That's their plan all along, is to just engulf it, kind of let it wither away till it becomes basically an emergency room, an urgent care center, that's it. Because it's much more financially efficient for them to have all their services in one place, not in 2, 3, 4 places. So they want to have a centralized location where they have the predominance of all their services rendered, and then feeder hospitals out there that feed into the big house, as we say in medicine, that feed into the centralized hospital. So to think that we're going to have more services here, if someone buys it, is a joke.